Therapy can be a life-changing experience. It can help us break free from old, unhealthy patterns and even heal from past trauma. But we don't talk much about what to expect in therapy or how to know what we can get out of it. The conversation pretty much starts and ends with, well, you should see a therapist and get some help. We assume that once we reach out, we will get help and things will start to feel better. But that's not always the case, which is why today I want to address the 6 things we should not expect from therapy. And the first and most important one is that they will fix all of our problems. Going to therapy, unfortunately, isn't like taking our fridge into the repairman. They don't know what parts are faulty right away and are able to replace them. We have to work through our issues, figure out what's going on, and work together to come up with possible solutions. And this all takes time, hard work on our part, and a lot of practice. The things we work on in therapy aren't easy, and it can even take us a while to figure out what change we're capable of making. So be patient with yourself as you sort through it all. Decide what it is you want to change and work to make those changes. It's hard, but trust me, it's totally worth it. Now, the second thing that we should not expect from therapy is to date or become friends with our therapist. It's actually against the law for us to try and date a patient if we've seen them within the last 3 years. But I would argue that it's never okay. As for being friends, that's not right either, although it's more of an ethical issue rather than a legal one. But either way, consider how one-sided or off-balance the relationship is. If therapy's done properly, you don't know much about them, and they know all the private stuff about you. Not to mention that we came to them looking for help, and they're the professionals whose job it is to help us. That's not a healthy dynamic for any relationship. We should be learning about and building trust for one another at the same time. Now, I do want to mention that as a patient, it is normal to want these things to happen, especially if we're healing from trauma, have attachment issues, or borderline personality disorder, just to name a few. But it's up to the therapist to explain why it's not appropriate and work with you to figure out where it's coming from and how to process that need or childhood wound. Moving on to number 3, they shouldn't be insensitive to your religion, culture, age, gender, race, sexual orientation, etc. In order for therapy to work, we have to feel like our therapist gets us, respects us, or at least tries to, and lets us teach them when they don't understand. And I don't say that to make you think that it's your job to teach them, but if they get something incorrect or say something that you don't think is appropriate, they should ask questions to clarify and really listen to your answers and possibly do their own research about something so that they can better assist us. They should also support us and be sensitive to our unique needs. It's not a therapist's place to push their own thoughts or beliefs onto others or to treat us differently because of ours. That's actually the opposite of therapy. So if your therapist is consistently insensitive to your background, beliefs, etc., it may be time to find another one. And as a side note, this is why we shouldn't know too much about our therapist. Because even if they are, let's say, Catholic, that shouldn't get in the way of them supporting our atheism, just for an example. Knowing too much about our therapist can make it harder for us to be open and honest, when this shouldn't affect their ability to help at all. Moving on to number 4, which kind of rolls off of number 3, and that is they shouldn't be judgmental or critical of us. When we tell them something that we're upset about, it's not appropriate for them to use words like only, just, or ask questions saying why. Meaning they shouldn't say things like, oh, well, that's only depression. I have so many other patients with it worse. Or, why did you do that? Or, oh, you're just self-injuring. These words are minimizing and can make it harder for us to open up and feel like it's okay to do so. They can cause us to question if we really do need help. Or what I hear from a lot of you is that you already worry about taking that hour for yourself because, you think someone else could need it more, or it's hard for you to take up space and to actually utilize help. And that's why it's imperative that our therapist is accepting and validating throughout our sessions. This doesn't mean that they accept and support us talking trash to ourselves or doing something harmful, but they should listen and validate our experience. Then they can ask questions to get us to see why maybe that behavior wasn't helpful, or that when we do that self-destructive thing, we only feel worse. That's what the therapy process should be like. Next up is number 5. And we should never expect our therapist to give us unsolicited advice or tell us what to do. Contrary to what many people think, a good therapist won't tell you what you should or should not do in your life. Our job isn't to instruct you to break up with that toxic boyfriend or girlfriend or take that promotion and move to another city. Our job is to help you build a healthier sense of self and confidence to make your own decisions. We can encourage you to consider the pros of that choice or take note of when someone puts you down. But what you do with that information is always your decision to make, because you're the one that has to live with it. It's your life, not ours. So don't let a therapist tell you how to live it. Our goal is honestly to help you create the best life for you. And we can't know what that is without your input. So a good therapist will always push you to notice uncomfortable or unhealthy things, but leave the choice up to you. And finally, number 6, we shouldn't expect our therapist to pick up calls, answer texts, or do anything else in our sessions other than listen to you, take notes, offer thoughts, insights, questions, or feedback. So often I hear how a therapist takes other patient calls or texts people back while in session with a patient, and I cannot for the life of me understand why they would think this is okay. The 50 minutes or so that you get with your therapist is your time, and they need to treat it as such. And to be honest, the 10 minutes that we get in between each appointment often isn't enough time. But that's why I personally give myself a free hour every 3 to 4 patients so I can catch up on my notes, grab some food, call people back, etc. Our therapy time is sacred. Being vulnerable about life experiences and sharing things we may be afraid to talk about needs to be respected and held in that space. To feel like someone isn't listening or even paying attention to us can do more harm than good. To recap, because I know that's a lot to remember, the 6 things we should not expect from therapy are, number 1, that they will fix all of our problems. Number 2, that we will date them or become best friends. Number 3, that they will be insensitive to our religion, culture, age, gender, race, sexual orientation, etc. Number 4, that they will be judgmental or critical of us. Number 5, that they will give us unsolicited advice. And finally, number 6, that they will pick up calls, answer texts, or whatever, other than listen to us during our appointment. I know reaching out to see a therapist can be scary, and I'll be honest, even when I go between therapists, like right now I'm between therapists, it's hard for me to speak up and reach out, and it takes me way longer than it should. So trust me when I tell you that it's difficult. Also, the last time I was trying to find a therapist, it took me 4 failures before I found one that I actually liked. So if you're caught in that process, just know you're not alone, and there are good therapists out there. We can find someone who's a good fit, who actually gets us and doesn't do any of the things I talked about in this video. And also, as a side note, because I hear this all the time, all of you are deserving of care. We don't have to be feeling at our worst or potentially suicidal or struggling with a really intense mental illness to warrant getting professional help. Just like our physical health, the sooner we reach out and the sooner we see someone, the better. It's like if we went and got checked up by the doctor when we just had a runny nose versus waiting till we have walking pneumonia, it's going to be a little bit easier to treat. And also, we won't feel bad for as long. So just keep that in mind when you consider reaching out. And don't be like me. Reach out sooner, because the sooner we do, the sooner we can start feeling better. I hope this helps you know what to expect from therapy and ensures you get the right help when you need it most. Have a wonderful week, and I will see you next time.